My name's Dan, and one of the ways I actually got into this whole functional medicine and holistic wellness model was years ago when I was much younger. My mother was diagnosed with Graves' disease, and that's a thyroid condition where it's hyperthyroid. You're producing too much thyroid hormone, and the solution was to take out the thyroid. And in my family, everybody thought, well, yeah, if it's not working the way it's supposed to, take it out. Well, unfortunately, that's kind of the model that we see for a lot of things. And unfortunately, there's a lot of things that are dysfunctioning in our body, and you can't take it out. And if you can take it out, well, maybe that's not where it started. So the problem is if you take out something that's being attacked by your body, or you take out something that's acting, errantly, you never figured out what the root problem is, and so it's still there. And does that take away from your health? Absolutely. I mean, today we know that if someone has an autoimmune condition, within 3 to 5 years, they can have a second and a third autoimmune. I mean, what are you going to do? You're going to keep taking parts of the body out or giving more meds to suppress the immune system? That's a bad model. And so over the years, I just saw my mom's health wither. And I got to tell you, it's upsetting. There's a few things I always say that we don't talk about in healthcare. One is if you're on the sidelines, you're suffering too. Nobody suffers alone, right? And the second thing is well, what are you missing out on because you have something that hasn't been properly treated in your body? And so it gets pretty scary. So we got to actually dig in, and that became my philosophy. Let's actually dig in and find out what the root problem is. In our office, our motto is, to help as many people possible with the natural approach, limiting the need for drugs and surgery. And I love that. And when you actually come in, what we really want to do is help people live longer by living better. Because, nobody wants to live to 110 years old if the quality of life is crap, right? And so that's what we're trying to do. And that's the biggest driver for me has been my mother and some of my family. I want them to live longer, but not at the rate of how they're feeling now, because they wouldn't even opt to live longer a lot of times for the way they're feeling. So I decided to dig in and get to root causes. And finding answers isn't always easy, and that's why you need someone who's been driven to find those answers for you and can put you on a plan to get you where you need to be.